Ulcerative colitis is a type of inflammatory bowel disease. It is a disease that is characterized by the inflammation of the large intestine or colon. It is most common between the ages of 15 and 30 and 50 to 70. People with this condition often have other immune problems. Things like stress and certain types of food can trigger outbreaks of the disease. There is no known cause, however, risk factors include family history and Jewish ancestry. This diagram shows the difference between a normal colon, a colon infected with Crohn's disease, and a colon infected with ulcerative colitis. With the colon that has ulcerative colitis, you can see that there is a loss of haustra and ulceration within the linings. You can also see that there is crypt distortion in the histology specimen below the diagram, and then you can see an actual inside of an intestine of what it would actually look like if it were infected versus the scope view of the normal intestine. This next diagram shows the location of ulcerative colitis versus that of Crohn's disease. Ulcerative colitis tends to occur in the second portion of the large intestine, or the descending and sigmoid colon areas, whereas Crohn's disease tends to occur in the far end of the transverse colon and the ascending colon. Symptoms may include abdominal pain and cramping, abdominal sounds which would be like a gurgling or splashing sound heard over the intestine, blood in stools, diarrhea, fever, weight loss. In children, growth may slow, gastrointestinal bleeding, joint pain, mouth sores, nausea and vomiting, and skin lumps or ulcers. These symptoms may start slow or suddenly and range from severe to mild. This disease is diagnosed through the use of family history and a colonoscopy. Tools to diagnose condition also include complete blood count, C-reactive protein, and sedimentation rate. The goal of treatment is to control the acute attacks, prevent repeated attacks, and to help the colon heal. Often hospitalization is often needed for severe attacks. Doctors may prescribe medications that can be used to decrease the number of attacks, such as mesalamine or sulfazine, which can help control moderate symptoms, immunomodulators, corticosteroids, or infliximab if other biological treatments if you do not respond to other medications. They may give diet suggestions, which would include eating small amounts of food throughout the day, drinking plenty of water, avoiding high-fiber foods, avoiding fatty, greasy, or fried foods, and limiting milk products if you are lactose intolerant. They will also recommend that you find ways to manage your stress levels, as high stress levels can cause symptoms to flare up. As a last resort, the doctor may recommend surgery to remove the colon, which will cure ulcerative colitis and to remove the threat of colon cancer. It is usually recommended for patients who have colitis that does not respond to medical therapy, changes in the lining of the colon that are thought to be precancerous, or serious complications such as rupture or hemorrhage. For the first 10 years after diagnosis, the prognosis for most people with ulcerative colitis is good. The rate of colectomy is low, and most patients achieve remission. However, anywhere from 10 to 40% of patients will require surgery to treat the disease.